Hello, everybody. It's nice to be with you. It's my honor and privilege to be with you. I'm looking forward to sharing some important information with you. My topic today is going to be on mastering pain management in dentistry using advanced techniques for optimal patient's comfort. And I am a graduate of Temple University. I'm practicing general dentistry. I've been practicing general dentistry since 1996. I am a graduate of Temple University from Philadelphia, Pennsylvania. I am speaking live from Philadelphia, Pennsylvania. I've been practicing in Pennsylvania, the greater Philadelphia area, since 1996. Okay, I started my private practice in 2000, and since then I've been expanding my practices and working with a number of associates and training a number of associates every year. And as of today, as we know, the pain is one of the most important factor in stopping patients coming to our practices. There are three factors, and pain is one of them. The other two factors are the cost and the time, right? So if we can manage the pain better, then at least we can win one out of three, okay? And then to win the other two, offering the patient financing and providing more services under one roof, providing better anesthetic, okay, to have patient better experience. And speaking about the experience, the better anesthetic, this webinar is sponsored by Orablock or the Pearl Pharmaceutical Company. Their support is highly appreciated. Without their support, I wouldn't be able to give you this webinar. So Pearl Pharmaceutical Company is the one who's giving the support for this webinar. And thanks to Viva Learning for giving their platform to share this knowledge with you. Okay. And the pain management is extremely important in dentistry, okay, because that is what's going to drive patients to our practice, okay? And anxiety and the fear of the dental treatment is one of the major role that plays in patients from coming to our practice. So if we can eliminate or come up with some solution to help patients reduce the anxiety, it would be a win-win for us and for the patient. According to research, anywhere between 50 and 80% of the adults in the United States have some degree of dental anxiety, and that ranges from mild to severe. Okay, and more than 20% of dentally anxious patients do not see a dentist regularly, and anywhere from 9 to 15% of anxious patients avoid care altogether. So it is extremely important that we come up with the ideas, employ some technology, add some equipments, products to help patients have better experience in managing the pain, just so they can accept more treatment. They would have trust in us and reduce their anxiety and phobia. Okay, the other the factors that play a role from patient's side or patient's perspective is the communication, trust, and the time factor. And like I said, cost and insurance coverage is another one that plays a role. So just make sure you do not, come up with the some cheap products or unable to treat the patient with the pain. You're going to lose trust with the patient, and that's going to cause attrition of in your practice. And then you may be advertising a lot more to gain more new patients, but at the same time, we're not paying attention to attrition in the practice. So it is very important to look at what's causing our patients to leave our practice. Okay. So continue to employ new technology. That's what I'm going to be discussing in this webinar, what technologies I implement in my practice to retain my patients and not having to market so much to continue to gain new patients. And when you provide excellent care, proper communication, you see the patient has trust in you. That means your staff has trust in you. They're gonna be behind you to support your practice and give you more productive dentistry, and you're gonna have a much better outcome. The preventing the scenarios that could lead to pain. Okay, so if we don't have way of proper diagnosing the treatment. That means we're leaving patient in discomfort. We're giving medication versus treating the cause. Okay, and patient coming back or calling back, taking up a chair time, then we end up referring patient out to another provider. So having proper tools to diagnose properly is going to reduce, your referrals. You're going to be able to provide better service to the patients. You're going to be able to carry out the procedures the same day. Okay, and to do the proper diagnosis, you definitely want to invest into intraoral camera, the high magnifying loops, along with the LED lights. Okay, CBCT is a must. Okay, without CBCT, it's very hard to diagnose from the 2D images. So then you're going to have patient coming back and forth until you end up referring patient out. And when you refer patient out, that patient may have lost trust in you. So I would highly recommend, before you buy Panorex, buy CBCT. Don't look into buying the Panorex, because nowadays Panorex is secondary, and you can always make Panorex out of the CBCT. Okay, and when the patient presents with once you know what the symptoms are or the cause is, okay, you want to treat the cause versus treating the symptoms. If you just keep giving the medications, of course, patient is going to look for another opportunity or another provider. They're going to talk to their family members. Then they may go somewhere else, and then you end up losing that patient. And not only you end up losing that patient, now that patient takes his or her family to that new provider. So please invest some time into a new technology, definitely CBCT, NIRI technology, which is infrared, near infrared imaging that's provided by some of the companies such as Dexis or Itero. Some AI technology is outstanding nowadays. Okay, the Pearl AI technology, the technology from Overjet. So that's going to also help you, and it's going to increase your productivity by 37%. So if you imagine that it not only increases your productivity, but it also helps you diagnose better. Okay, then we're going to be talking about the how to manage the dry socket, the perio problems, and the GBT, guided biofilm therapy, and the next slides. So look out for more information coming up. Okay. So this is diclonine hydrochloride, which is diclopro, that I use in my practice, especially in the perio department or my hygiene department. I also use it for my full mouth dentistry. When I need to numb full mouth, I use diclopro to numb the patient. They switch about 3 to 5 ml for about 30 seconds to a minute. Okay, that kind of numbs the entire mouth. Okay, if you're taking the impression, you can use this product when you're doing a scanning and that scanner causes the gagging in the further back. You can use this product, but most importantly, using it when you're numbing the patient where they feel minimum discomfort, injecting in entire mouth. So this product can be purchased from your local dental dealer, but it's highly effective. Okay, if you don't want to use this, there's another product called that you can get it from your own pharmacy, the compound pharmacy, the magic mouthwash, which you can use as well to help patients get the full mouth numbness topically, and then start injecting in the sites that you're working. This is also another the product that I use in the hygiene department. Also for treating the peri-implantitis, because nowadays everyone is doing implant dentistry, but there are so many complications with implants, as we know. And very few of us are trained to treat peri-implantitis. Okay, so having this technology, which is called guided biofilm therapy, it's extremely effective. I've been using this product for about 3 years now. Okay, I have GBT unit in each of my hygiene room. Okay, and it's extremely effective in removing biofilm. Okay, it definitely saves a lot of chair time for the hygienists. Hygienists love it because it makes their life much easier. They basically use the Optragate first, retract the patient's cheek. They use the high volume suction along with the GBT. Okay, they go around every tooth in a smiley face. Okay, for about 3 to 5 seconds per buccal, per lingual, per distal, blah, blah. Okay, and they kill the biofilm first, then they'll go with the ultrasonic to remove the tartar. That tartar that was remaining there is already free of bacteria, but it is very precise, okay, in killing the biofilm, along with giving you removal of the stain. And this particular unit, or both of the units, you can use erythritol powder, which is 14 microns powder. You can use a glycine powder, which is around 24 to 26 microns. And then if you have a heavy stain patient with wine or coffee drinker, you can use 60 micron sodium bicarbonate. But so it's quite effective in killing the microbiofilm. And also, it comes with the perio-tip, which you can take it up to 9 millimeters below the gingival tissue to attack that pocket in killing the bacteria. So I highly recommend looking into airflow or the GBT that's sold by Woodpecker, okay, which is also a great company. That's a new competitor that came out, and they have a really good customer service. And you also save about 50% cost by having it bought from Woodpecker versus from EMS. This is another product that came out to assist in oral tissue decontamination. Okay, it's a liquid gel. It comes in liquid or it comes in a gel, which you can inject into a pocket, or after taking the tooth out, you can let it sit in the pocket for about 15 to 45 seconds or so. You then rinse it off. It is extremely effective, okay, in killing the microorganism. Okay, and it definitely gives you much better bacterial decontamination. It definitely reduces the risk of infection, post-operative discomfort, and very easy to apply. It enhances the healing process. Okay, and it doesn't cost much at all to buy this product from your local dental dealer. So having this product is now another alternative to Restin. So Restin is a great product, okay, which is site specific, and so is this product. And this is a new one that just came out in the market, but highly effective, and it does not contain any antibiotics. And we do have some patients who don't like antibiotic, or they're holistic patients. So this will be an excellent tool to add to your armamentarium. Then the anxiety comes also from the fear of pain from the patient, from the needle. Okay, so giving injection is not, it requires a lot of skills and technique to make it painless, and it's very hard to make it painless. Okay, so this particular device, okay, from DentaPen is going to give patient much better experience. You will have full control over it. It's going to be extremely gentle, and it's going to be gradually giving anesthetic to the patient's tissue. Okay, so not only you will have a better patient experience, but it's going to reduce the anxiety. Okay, and you don't have to buy multiple products. Just buying this product, you can just use your normal Articaine, which I use from AuraBlock, which we'll talk more about the AuraBlock. Okay, because it's very potent and very profound anesthetic. Okay, which you just need to use half a carpule to 1 carpule at the most, okay, for half a quadrant. And it's extremely effective in causing minimum pain, okay, to no pain, to be honest with you. And if you have a great technique in warming the carpule with the with warm water, or using carpule warmer, which we'll talk on the next slide or so. And but when I do the okay, let's go the okay, yes, here's the carpule warmer, because this is the one of the company that makes the carpule warmer. There are at least 5 to 6 companies out there that are making the carpule warmer. What I like about this particular carpal warmer is that you are limited to warming, about 7 carpules versus having so many carpules in a carpal warmer. Okay, so this way, your anesthetic does not denature. Okay, remains very strong, very potent, and by having the carpal warmer, it reaches the patient's the temperature of the anesthetic reaches the patient's body temperature, okay, and thus it makes it a lot less painful when injecting it. And then using the Aura Block, okay, which is the articaine made by Pearl Pharma, which is the company that I buy it from, or the product that I use, okay, that you can buy it buy from your local dental dealers. Okay, the Aura Block is another competitor to other companies who make articaine. Okay, and there are about 4 to 5 companies who makes articaine. Aura Block is going to be saving you some money, okay, over other articaine that you use. It's as effective, if not more effective, than the other ones that you've been using. And instead of using 2% lidocaine or 3% bupivacaine, Aura Block is your far better options. 3% bupivacaine, I use it for patients who are very acidic, or whom I did not get numb after using 2 carpules of lidocaine or Aura Block. But lidocaine is now mainly used for pediatric patients in my practice, and Aura Block is number 1 choice of anesthetic in my practice, because it's very simple. It gives you precise relief to the area that you're working in, okay, and you're able to start the treatment right away. I personally start the treatment on upper arch within 30 seconds to a minute. When I use the Aura Block, I wait about 3 minutes for the lower arch, okay, and when numbing the patients, warming up the carpule is going to make it a lot easier, or using the slow injecting device to make the experience better for the patient. And they come in 2 different concentration or the ratio. I personally use 1 to 100,000 injection. Those who are sensitive to epinephrine, you can go to 1 to 200,000, but mostly 1 to 100,000 is more than enough. And you can use up to 7 carpules on adult patients, and it's very safe. Mm-hmm. And the Aura Block also makes the needle, okay, they came out with these needles about 4 to 6 months ago. They're much better needles because they're the most advanced needles that are out there. They come in about 5 different sizes, okay, 30 gauge extra short, 30 gauge short, 27 gauge. They're color coded. And my go-to needle is 30 gauge short for the lower blocks. I personally use 30 gauge short for all of my injections. I hardly go to 27 gauge long. Beside that, there are doctors who are out there that are having great success with 27 gauge short, and others also claim that they have same amount of discomfort to the patient using 25 gauge versus 30 gauge. So, but in my hand, 30 gauge short works the best for all the areas in the mouth. Okay, and here they come in 5 different colors and 5 different sizes. So it's definitely looking into it, because worth looking into it, because Aura Block again is going to be saving you some overhead, okay, because they're not as expensive compared to other brand name. Okay. This is another toy that I have in my practice, which helps a lot, okay, in providing minimal pain-causing dentistry, okay, because instead of using the handpiece to remove the broken root tip, okay, having to keep fighting using your elevator, you rather use the piezo tone that comes with the multiple different blades that you can go into PDL space depending upon the angle that you need to use. Okay, it's very easy to use. It takes about, I would say, 3 to 5 minutes to go around the root tip, and it's going to elevate the root tip out very, very easily. especially working in the sinus area where you know that your root tip may go into sinus and you don't know whether you're going into PDL space or not. Whereas this tool comes into very handy because you're able to go into PDL space, create the space, or elevate the root tip out, and you're giving the patient the better experience. You also are not referring patients out. You're also getting paid for the service because you're not referring the patient out or refunding the money to the patients. This technology also has many other uses. One that I use it for is the hard tissue crown lengthening. You can also do hard tissue crown lengthening if it's a minimal hard tissue crown lengthening with a closed flap with their special tips that they make. And it's called crown extension kit. They also have the sinus elevation kit and bone surgical kit if you're doing the alveoplasty or alveoectomy, in which I use it for my all-on-X cases. So by using this technology, you're not introducing air. So of course, you're preventing the air embolism. Patient healing time is much faster because you're not causing as much trauma. So you're reducing the inflammation and thus it reducing the discomfort. So having this technology that you can buy from your local dental dealers, many of them make it, but there are 2 to 3 companies out there that make Piezotome or the Piezone, which would be worth investing into. This is a significant amount of investment, but it's going to pay itself up within the first 3 to 4 months. Okay. Another product that can help you reduce the discomfort, okay, giving the patient better experience is Gem 21, because many of us don't like drawing blood and spinning the blood and putting it in the extraction socket or the surgical site. So having Gem 21, it provides the same benefits, similar benefits as making the PRF from the patient's own blood. Okay, Gem 21 is a growth factor enhanced matrix. It promotes faster healing, promotes better healing and more predictable outcome for all your procedures. I use it. I mix it up with corticocancellous bone. If it comes with the bone grafting itself, but I do not use that bone graft because it doesn't turn into patient's own bone. So I highly recommend that you can throw that bone away. Okay, just use the liquid only and make sure you refrigerate this box. And when you're ready to use it, you need to take it out at least 10 minutes prior to using it. Okay, or you mix it with the bone graft 10 minutes prior and then you apply it. You don't want to just take it out and put it in the surgical site because it's not going to be as effective. Okay, and if you happen to leave it after you finish using half of it, then it is still good for a month. But when you can remember, put it back in the refrigerator. But it is going to be a decent investment, but it's going to give you much better outcome in a bone regeneration, tissue regeneration. You can this can also help you doing the recession, treating the recession, and it's going to reduce the post-op pain. That means minimum discomfort or minimum prescription that you need to provide to the patient, especially when we can avoid the narcotic. And that is what we're mainly talking about, is when patients call us or demanding for the narcotic medication. This is where adding these technologies or these products can definitely reduce the use of narcotic medications. Okay. Another product that does not require a lot of investment is the oral recovery care kit. This is made by Stella Life. Okay, and this is completely homeopathic. There are patients, like I said earlier, holistic patients who don't want to take antibiotic, and those patients that we know are slow in healing. Those are medically compromised patients. Those who are smokers. Okay, that this patient is going to be a challenging patient in terms of healing, and they're going to ask for more medication. It's going to take up more of your chair time. They're going to come back multiple times, taking away the time that you can give it to other patients. So having them buy this kit from your office is very important. Not only you're earning some money from selling these products, okay, but at the same time, you are you're asking patients to use it to help have a better healing, and make it mandatory. Hey, Mrs. Jones or Mr. Jones, I can only help you if you start using certain products, because I feel that healing is going to be compromised, and I may need to give you a referral to a specialist, blah blah. Okay, so having certain protocols in your system, in your office, the way you do dentistry is going to streamline the flow, and the patient's outcome is going to be far better. And of course, when the patient's outcome is far better, you have more patient retention and less attrition. Okay. The other products that I currently provide is the steroids. I also inject steroids intraorally when I'm doing the all-on-X cases, or when I'm doing the difficult wisdom teeth extractions, and I know I'm going to have some swelling related to cutting the bone away or doing the traumatic surgery. Even when I'm doing that, I'm still using Piezon, but now giving the steroids intraorally, injecting a steroid intraorally, it's very instrumental, okay, in reducing the swelling. And when you reduce the swelling, of course, that reduces the discomfort. Okay, and if you don't feel comfortable injecting steroids, then I would highly recommend that you use the Merdor dose pack. Okay, patient can start in the morning off, okay, and then continue on it until the course is finished. But not every patient requires steroids. But those cases that you do high-end dentistry, or you do very lot of surgical procedures, then giving steroids is going to give patient much better experience. And again, when you have much better experience, a patient is going to give you a better review. They're going to refer their friends and family to you, and you will have more patients coming in because of the patient experience. Okay. So in conclusion, the proper diagnosis is the key to avoid, okay, misdiagnosis, right? So misdiagnosis comes from not able to see everything that you want to see. And that's why investing in CBCT, iTeroscan, or Dexcam, or the Carestream CS 1500, and using other additional high-end technologies going to give you a much better diagnosis to lessen the discomfort the patient will have. Okay. Now, treating the source is, of course, important versus treating the symptoms. When you treat the symptoms, you're going to see some of the patients not returning to you unless you bonded with the patient so well. Okay. And some of the patients have ongoing gum issues, and we know some of the gum issues due to malocclusion, right? So if you don't treat the malocclusion, if your hygiene department is not up to date in terms of education, it is important that you go over what malocclusion can lead to. Okay, it can the crowding, lingual inclination, abfraction, wearing, shifting, scalloping tongue. These are all signs of the malocclusion. So just make sure that you help patient. I mean, you have your hygiene team supporting you in addressing the treatment for malocclusion. Because in my practice, we use aligner therapy, and we don't do any braces treatment. So we refer patient out to the wire treatment. I also employ 3 different types of laser. I have diode laser, periolase laser, and biolase laser. Okay, lasers, of course, are very instrumental in giving us much better outcome. Okay, compared to a non-laser treatment. Inflammation goes down quite a bit with using the laser. The tissue heals much better. You can also use the laser for treating TMJ, also photomodulation. Patient with the paresthesia, you can use the laser to enhance the blood flow and the regeneration of the nerve endings. So definitely look into investing into laser treatment. Okay, and the water lace that I use is very precise in making the incision. Okay, it's more precise than the 15 blade. Okay, it releases the histamine. Okay, and at zero, so after the water lace, so that and it also cools the surface by 2 centigrade, and so it's very painless to the patient. And it can be used on the implant surface, and then you will not have the tissue burning out, or your patient will not have the burning smell as well. Okay, and with the laser, you can do many more frenectomies as well. Okay, and when I also use the laser for socket disinfection or socket sterility after the tooth is removed. I use the laser to create the hemostasis, and the reason I do that is to promote the healing and to avoid the dry socket. Okay, so but not every time you can avoid the dry socket. So when there is a dry socket incident, oxygen gel is very effective in relieving the dry socket. So what I do when doing the difficult extraction is I personally dispense oxygen gel tube to the patient along with the 12 cc curved irrigation syringe along with the 1 bottle of saline. So let them irrigate at home, apply the oxygen gel. So this way they can heal much faster, remove the foreign body, and reduce the pain medicine. The other products that I have been using for about 4 to 5 years now is a perio gel. Okay, perio gel is a gel that we use with the perio protect trays. Perio protect trays are made by Perio Protect Lab, and it is extremely effective in killing the bacteria. Okay, and it cleans the wound much better than other medication. It uses the 1.7% hydrogen peroxide. Okay, it's patented hydrogen peroxide in concentration. There's no allergic reaction to it. And it breaks down the bacterial cell wall. Okay, and that's how it kills the bacteria, especially the anaerobic bacteria. Okay, oxygenates the pocket, kills the bacteria, and the side effect of the Perio Protect is white teeth and fresh breath, which everybody would love to have, and the patient would wear it for 10 to 15 minutes a day. Okay, and they would do it 3 times a day. If they're severe perio, if they're moderate perio, they do it twice a day. Okay, and then if it's a maintenance, they do it once a day. And they need to do it for about 3 months or so. And then once the perio is under control, they can go down to once a day. But it is extremely, extremely effective in reducing the pocket depth. And it is also very effective with the patient who have all-on-X implant cases. So I also provide my patients with the Perio Protect trays, those who get all-on-X cases, because as we know, there are a lot of implant complications, and peri-implantitis is one of the complications with implant dentistry. So if you can be proactive and prevent it, okay, versus reactive, I highly recommend that you start implementing perio trays in your practice, and this one does not require investment at all. Okay, just buy it as you go. Okay, unlike the laser or the piezotomy. The dichlorobenzene that we talked about is very effective in giving the full mouth anesthesia, topical anesthesia, where you can just go and inject patient after 30 to 45 seconds. Okay, GBT, definitely have GBT in your practice. It's one-time investment, but you will make that up within 3 to 4 months. Okay, slow tooth anesthesia, we talked about giving injection at very slow speed, which is very gentle and effective for optimum comfort for the patients. Aura block should be the choice of your anesthetic. Even a patient with the heart condition, you can use up to 2 carpules of aura block. It's safe. Okay, and when I give injection to the lower inferior alveolar block, I usually give injection in 4 or 5 different spots. Maybe about 10 to 15% of carpule I inject in one area, then I'll come back and inject in another area. So I make a dime-sized circle, and I just go in different dime size area and just making sure that I inject into that amount of space that I can get the patient within a few minutes, but I can go and start my procedure within 3 minutes. But oral block is going to be the best anesthetic when it comes to treating all type of dentistry. Okay. PAs at home, there are 3 or 4 companies making it. Highly recommend it. You're going to have much better outcome. It will give you more support and more avenues to do more dentistry. Okay, it's going to make you more confident, and it will reduce the referrals, and you're going to have better patient outcome. Okay, steroids. Don't be afraid to prescribe steroids if you are doing, a lot of implant dentistry or difficult extraction cases. Okay, Gem 21. Again, it's worth using the product. You can bill for it. Okay, through the insurance company, and there is a code for it, and anywhere between $400 to $500 is the allowance from the insurance company, those who cover it. But it's worth investing it. The cost itself is going to be around $250 to $300 for the kit, but it's just a matter of 5 minutes. You mix it and use it, and it's going to get a lot better outcome. Also, Stella Life, giving that mouthwash, mouth rinse along with the oxygen gel. Okay, it's going to help reduce the discomfort. And then they also have a special mouth spray that keeps the mouth wet, which also helps treating the dry mouth syndrome. Okay, with that, my presentation is over. I'm happy to take as many questions as you like. And it was nice time spending with you guys, and I look forward to answering all your questions. So let me look at those questions. Bill Pooh said dexamethasone is much better absorption profile over Merdor-Dospec. I agree, because it is going to be more precise. It's site specific, and the patient doesn't have to take it systematically, right? So if you can become comfortable injecting dexamethasone or steroid, it will be a lot better for you. I personally use dexamethasone sodium phosphonate. I buy 120 milligram per 30 ml bottle, and I'm able to use it for at least about 15 to 20 patients. Yeah, my thoughts on 2 different GBT machines. It's a new machine that just came out by Woodpecker is better, because I had my hygienist use both machines. Woodpecker just came out about 5 months ago. Okay, they're based in California. Okay, and my hygienist did split mouth study, or then did a half mouth with the EMS and half mouth with GBT. With Woodpecker. Okay, so Woodpecker was a winner. Okay, because you're able to warm up the temperature more. Okay, and you also increase the power on the airflow. So it's much better. Plus, you don't have to change the attachment when you're using the sodium bicarbonate versus glycine versus erythritol. So I highly recommend Woodpecker over EMS. Okay, but the heart conditions, I use the regular inferior alveolar nerve block. There's no difference in numbing the patient with heart condition. As long as you stay 2 carpules or less. Okay, then if you have to use the 3rd carpule, you can go to 3% bupivacaine. Then if you need a 4th carpule, you can continue using more and more bupivacaine. Okay, but up to 2%, up to 2 carpules of articaine is very safe. Yeah, anxiety management. I did say, that you can use multiple products to reduce the anxiety. Of course, you can use nitrous oxide is one of your sedation, right? But some patients can afford the nitrous oxide, or some doctors are not certified to provide the nitrous oxide. So using the Valium or Halcyon, okay, is another way to reduce the anxiety, and giving them the music, let them watch the TV, talking to them, let them be in control, listen to them twice as much. You speak once and you listen to them twice. Okay, it's just having a really strong bond with the patient, and clear communication with the patient, and running down how the flow of the procedure is going to go. That's going to reduce the anxiety, and that's how I manage the anxiety with the patient. I let them talk, make sure they have no question, concerns before you begin the treatment. So I talked about the dexamethasone that I use for pain management. Is that, like I apply approximately 4 ml in the vestibule area. If I'm working in the upper left quadrant, I'll use 4 ml, and I'll put a few drops in about 3 to 4 different sites where I created the trauma. Okay. Yes, I do recommend pre-op medication for those who are very, very anxious. So of course, you need to speak with the patient first and see them in person first before you prescribe the medication. But the one that I prescribe to the patient is Valium or Halcyon, and they take it night before, they take it morning off, and they bring the tablet with them, and I crush it and I put it under their tongue. Okay, and then if you give nitrous on top of it, you're going to have a lot more happier patient, and patient probably most likely be having or sleeping through the procedure. The webinar cannot. For dental assistant recertification, I would not know. You need to check with your local board to see if you can use this CE for your to count towards your CE. For pregnant patients, I would limit up to 1 carpule. Okay, and as long as if you're giving a block, but if you're giving a very locally infiltration, just as long as you're not in a blood vessel, okay, you're fine. And I personally give a lot of infiltration on a patient that is very difficult to numb, or if I'm doing an implant uncovering, I will just use the gingival infiltration with 4% articaine, which is the aura block. Okay. And then if you, going back to the previous question, dexamethasone, if you want to use it orally, you can give 8 milligram after the procedure, and the first day, and then 4 milligram once a day for 5 days. Okay. Is GBT the same as power scaler, or is it? No, GBT is not the same as power scaler or air polisher. Air polisher uses, there are a couple of air polishers out there, the newer one made by Acteon and NSK that does use glycine. Okay, but the previous one that is made by that comes with the Cavitron from the Dentistry that uses the 60 micron sodium bicarbonate, so which is more detrimental to enamel. Okay, it's more effective in cleaning the stains from interproximal area or from the facial surfaces or lingual surfaces. That the glycine or erythritol is the way to go nowadays, because it's much gentler than using the prophy paste. And when you use the GBT, you do not need to use followed by prophy paste. You can decrease your costs buying the prophy paste when you're using the GBT. Yes, you can give 2 carpules of lidocaine and 2 carpules of articaine at the same time, but that's not necessary at all. Okay, what are we trying to gain by giving 2 different anesthetic? And that's total of 4 carpules, 2 carpules of lido and 2 of articaine, where you can achieve the same anesthetic result from using 1 carpule of articaine. So there's no need to use 4. Okay, this was a excellent webinar. I thank you all for joining. I am done answering all the questions. I don't see any more questions coming up. Here's my contact information. Should you need to reach me afterwards, you're welcome to call me. You're welcome to email me. And I'll be happy to share with you technologies that I currently have and where to get it from, who to contact. But don't be shy to, or don't be left behind to invest in the technology, because it's going to pay for itself, and you're going to have a better reputation in the community. And of course, your patients and your staff will love you. Thank you all for attending this webinar. I wish you a great day and have a good night. Bye-bye.